So this is the debriefing for our February buyout. We're in February. It's hard to believe. And so this is the first time Nicole is going to participate in speaking about some of the cases she saw with us. So we're just going to kind of talk about, we're going to rotate through each of us as the cases go through. And we usually say at the beginning of every buyout debriefing that if we don't say that they got pain meds, but they were painful, they got them. We just don't want to keep repeating, they got this, they got this, they got this, when it's the same thing for every horse. Like if they're painful, they got pain meds.
So the first horse we looked at was Hanabi, a 12-year-old mare quarter horse. She was a bay. We looked at her first because she was blind in both eyes, looked overall just pretty uncomfortable. We took x-rays of her and she had a lot of bony changes, a lot of painful joint issues going on. So between the issues with her eyes and her joints, we did decide to give her the last act of kindness.
Our next horse, B2523, our supporters named Nutella, which is adorable. Nutella is an 18-year-old standard-bred mare. She is very big and very beautiful. She had some little minor scars on one of her eyes. She had a little superficial cut on her lip. She had a lot of scarring on her vulva, so I suspect she's had at least one foal. And she does have active mammary development, so she's down for a pregnancy check and a sedated dental. We ran blood work on her on the day of intake, and her calcium was pretty elevated, so that's concerning. But thankfully, we rechecked it today, and it's now within normal limits. So we're really happy about that. She is turned out to decompress in one of our quarantine pastures.
Next we have, he was named Rebel. He's B2524 if you're watching the intake footage. He was an 18-year-old gelding standardbred. His registered name was Huckleberry, which was really cute. He had a locked up jaw. He was hesitant to allow Dr. Lydia to look at it. And he had pitting edema in his hock, and he had mild digital pulses in his left front only. So we took radiographs, and he actually had evidence that he had had a fracture of his caudal thoracic spine. And he had old kissing spine and orthopedic changes and things like that. And so because of all of those things together, he was elected to give the last act of kindness just because his back and his legs were so painful.
Next is Charlotte, B25-25, a 22-year-old standard-bred mare. She had a 5 out of 6 systolic heart murmur, increased lung sounds, nasal discharge, cataracts in both eyes, an overall just kind of unkept appearance. On palpation, she was painful from withers all the way to the tailhead. And then we had some pelvic lameness and lameness in the left hind leg. So with all of that, she was recommended for the last act of kindness.
Our next horse, B2526, our supporters named Cowgirl. She was an adorable, teeny tiny little miniature horse, mare. We estimated her to be about 27, although her dental wear was pretty severe, so she could have been older than that. She had, right off the bat, you could see, obviously, that she had severe rotation and evidence of founder. We talk a lot about laminitis. But she had rotation of both her coffin and navicular bones. And then the right coffin bone was just disintegrated and spongy and just almost not there anymore. Her radiographs were just devastating. Her resting heart rate was 72. So upper end of normal for horses is about 36. And obviously she immediately got pain medication. She also had bilaterally increased lung sounds and just severe neglect. And she was given the last act of kindness.
Next we have Nevada. He was also an adorable little mini horse. He was approximately a 13-year-old stallion. And he also had some changes looking at him, but he had abnormal proprioceptive placing in his left hind. He had atrophy and he had pelvic asymmetry. And if you watch him in the footage, when he's moving, he'll actually just kind of pick up and drag the leg. He won't actually really place it and use it. So we were curious about maybe having a previous pelvic fracture or femur fracture or something like that. So we tried to get radiographs of his hips, but our equipment isn't powerful enough to shoot through that much density. So we got images, but they were non-diagnostic. And so then we went and looked at his stifle, and we found that he had a fibular fracture. So he, with all of his things together and how painful he was given the last act of kindness.
Next, we have B2528, named Echo. She was a 23-year-old grade mare. Copious amounts of purulent nasal discharge. Also had a 4 out of 6 heart murmur. A couple of cuts. She had one on her right front leg that went right to the joint, and then had an open hole in her forehead. And so we suspect it probably was all connected with as much discharge that was coming out of her nose. So with all of that, she was recommended for the last act of kindness.
We took some x-rays of her head, and we'll never know. Like, did someone actually try to use a captive bolt on this horse and they missed? We don't know. But she did have a pretty severe slab fracture in one of her teeth, and the tract from that broken tooth communicated with the hole in her sinus. So theoretically, that could have been related. B2529, our supporter's named Honey. She was a 20-year-old registered trotter. She was a mare, a chestnut mare, and her resting heart rate was 56. She had cataracts in both eyes, which is interesting for a 20-year-old. We don't usually see them that early. She had severe bilateral DSLD in both of her hind legs. Unfortunately, it's something we see a lot, probably because slaughter haulers can't pass inspections with horses that are this obviously lame and painful. It's really difficult to see in these cases. Often these horses, when they take a step, the back part of their joint will just like hit the ground. In this case, the DSLD was so advanced that her hocks above the affected joints were really swollen and effusive, and she was just really painful. And we gave her the last act of kindness.
B25-30, Reba was a 34-year-old quarter horse mare. She was sorrel with really cute bilateral hind socks. Her resting heart rate was 44, which is a little elevated. Her right front had what looked like on the outside possible rotation with severe hoof neglect. She was quitting and dropping feed. Pain on palpation of her spine from her withers all the way down her back to her tail head. So we took radiographs, and she definitely had a lot of lucency and rotation around that right front coffin bone, or P3. And she had a lot of imbalance, medial to lateral, which could be helped some with trimming, but the rotation would take a lot, and she was so painful that based on all that, the last act of kindness was recommended for her.
This really breaks your heart because age is just a number, like if you maintain your horses well, 34 isn't necessarily ancient, but like these poor guys, they just haven't been cared for at all.
Next is B2531, named Morning Dove. She was a paint mare, 18 years old. So she kind of had a lot of stuff going on. She had some issues with a little bit of everything. She was having a hard time placing some of her legs while she was walking, so we figured there might be something neurologic going on. We did do radiographs and had a lot of arthritic changes. And I'm going to let you talk about her swabs coming back. Because she was showing neurologic signs, we did send out nasal swabs and blood to do additional testing. And those came back as EHV4 and 1. So I will let either Dr. Lydia or Dr. Gina talk about what that means a little bit more.
So there are many different things that can cause neurologic signs in horses. So there's some quick tests that you can do. So we sent off nasal swabs, one for bacterial culture, which goes in a media, and then a dry swab, and then EDTA blood or purple top tube for serology. So we were testing for EHV 1 and 4, and those are equine herpesvirus type 1 and type 4. Type 1 more than type 4 will cause neurologic symptoms in horses. Both primarily cause respiratory infections, but secondarily they can also cause neurologic together, or they can also cause massive abortion storms in mares. So those are things that we're starting to look for, and Cord will test for them for us. So that's why we did nasal swabs and sent those off. And she came back positive on her dry nasal swab, not her EDTA blood PCR. So that was a little concerning. And then on her cultural swab, she had a lot of different organisms, some of which can cause zoonotic diseases in people, meaning it can cross from animal to human and cause diseases in people. So
With drug resistance.
yeah, so she had a lot of stuff going on. Yeah.
Those results, the neurologic signs, she did have pain during palpation of her C-spine. It was recommended for the last act of kindness for her.
I'm just going to throw in there really quickly. As in all species, herpes is forever, right? It's an incurable virus, and it has a annoying tendency to be asymptomatic until immunosuppression happens. But and even though it's not reportable, I don't know any boarding stable that will be like, oh, you got a horse that has EHV? Come on. It's a lifelong concern. So it's something that this mare would have continued to struggle with, but also would have made her a risk to other horses for the entire rest of her life. And she would have been really hard just for that reason alone, even without being really sick. This one was really heartbreaking. This little guy, B2532, his name was Pismo, which is a really cute name. He was a little colt. He was about a year old, and he had a fever when he came in. He had some swollen lymph nodes, and he just looked really, really unthrifty when he came in. He was lame on both of his hind legs, more so on the left than the right. We did note that he had some foaming in his mouth on intake, which we were all really careful. There's some really bad diseases that can cause foaming at the mouth, but that kind of passed. And we ran some blood work on him, and he had elevated white cell count, low hemoglobin, low calcium, and then he had some mild changes in his kidneys, but for a young horse, we don't want to see any changes in the kidneys. We sent some samples off for culture, and we found out that he had pretty significantly multi-drug resistant, multiple kinds of bacteria, some of which affect people, but also MRSA, methicillin-resistant Staphylococcus aureus. It's something that usually infects skin wounds in humans, but it's becoming more and more of a problem because we're seeing strains that we don't have antibiotics to treat. So that was really concerning. Today we observed him in pasture, and his buddies were running, and he just fell and just wiped out and laid on the ground. So he wasn't doing well. And then we also noticed on recheck that he was developing some ventral edema, which is another really concerning sign. So our team had a really hard discussion today. Nothing is more heartbreaking than having to euthanize a young animal. But in this guy's case, he just had a lot stacked against him, and he just felt really terrible. And then on top of that, he posed a pretty significant infectious disease risk to his whole quarantine group with that multi-drug resistant MRSA. So he was given the last act of kindness.
Next up is B25-33, Jerry, 24-year-old mare, Tennessee walking horse, chestnut with a nice blaze. She had a very tense face and mouth on presentation. She had severe left front and right front lameness and evidence of chronic founder with rotation. And we took radiographs, and it confirmed it for sure. And so because she was so severely painful, the last act of kindness is recommended for her.
All right, so B2534, named Ruger, is a 4-year-old mare Tennessee walking horse. She was pretty reactive, especially to the clippers and trying to draw blood and everything. She had a wound over her left eye with a lot of discharge. She also had a delayed pupillary light response in that eye. So tried to clip and clean it a little bit to what she would let us. And and gave her some antibiotics, some pain meds. We did get eyes on her today again, and she looks like that wound is starting to heal up. So we're keeping an eye on her. We're running some blood work as well, just to kind of see what her trends are for her blood work. But right now she is out with the rest of the group, and we'll see how she does.
B2535, our supporter's named Valor. He did have a brand, so we were able to track down his name, and it was Keystone Senior. He was a 19-year-old standardbred gelding. His body condition score was 1 out of 9. So that is, we body condition score horses on a scale of 1 to 9. A 1 is severely emaciated. He was super, super sweet, but very dull on intake. And he did have increased respiratory noises and nasal discharge. He had some wounds on his right carpus and his left hip. And Dr. Gina took radiographs of his hocks, his carpi, and his stifles. And he had really severe osteoarthritis in multiple joints. He had proliferative bony fragments around the areas where the joint capsule attaches. He had some dental pathology, and he had anemia and really low platelets. It's really heartbreaking because I didn't look him up. This guy probably worked for a living and should have had appropriate support and not have been worked to the point that he had irreversible arthritic changes. But when you have bone on bone, it's not fair to these guys to keep them going. So he was given the last act of kindness.
B25-36, Garnet, was a 22-year-old gelding Tennessee walking horse or gaited cross, bay horse. He was also a BCS of 1 out of 9, so he was severely thin. He was blind in his left eye, and it was cloudy. And he was very painful whenever you tried to do anything with his mouth. So, and Dr. Lee also noted that he had some pretty significant bilateral hock effusion in his hind legs. So we took hock rads, dental rads. He had a lot of dental pathology. He had multiple diastema, which is space between. So if you have this tooth here and this tooth here, there's space in between them, and food packs in there and creates ulcers. So he had periodontal disease that was pretty advanced. And he had a lot of changes to the mandible roots. Down here, there was periapical lucencies and things like that. So he had a lot of dental disease, which probably contributed to how thin he was. And he also had some bony changes in the joints that we had taken radiographs of. He had anemia, and he had some elevated AST, which we usually look at that with either CK on the chemistry or GGT to either say, is it muscle or is it liver? So it was more than likely he had muscle damage, and he had a high normal potassium. So given all of these things all together, how painful he was, and he just looked like he felt pretty bad. So given all those things, the last act of kindness was recommended for him.
B2537, Victor, 3-year-old gelding Tennessee walking horse. Overall, he looked pretty good. Was a little bit off in the left hind at a trot, but otherwise, he was one of the ones that he surprisingly looked pretty well. We don't have too many concerns about him. We are going to do a lameness recheck after his 30-day quarantine during his training evaluation, and then kind of see if we think he'll be able to be ridden or not. We did watch him again today, and he still is a little bit off in that left hind, but we're hoping that with a little bit of rest and just being able to hang out in the pasture, he'll come around. So yeah, one with not too many concerns.
Raspberry, great name, B2538, is a yearling Tennessee walking horse mare. She's really big for a yearling. She had some sounds in her cranioventral lung, which is the front part, bottom part of the lung. Often that's like an aspiration pneumonia kind of sign. She had a lot of scars on her left cornea, And she wasn't blind in the left eye, but she has reduced vision on that side. And her blood work showed, so young horses should have higher calcium than adult horses. So technically her calcium was normal per our reference intervals, but for a yearling, her calcium was a little on the low side. She had a low hemoglobin and hematocrit, so that indicates kind of mild anemia. But overall, I'm very hopeful for her. She's doing really well. We rechecked her today, and we have her down for some blood work and to recheck her lung sounds. But right now, she's just turned out to decompress.
Next, we have B25-39. He's another one of our yearling colts. His name is Ranger. He's also a Tennessee walking horse, and he also has a left hind lameness with swelling. So right now, he is on our to be castrated list, but we're waiting to see how he does with his left hind leg. So he's just turned out in pasture with everybody else, and we are kind of keeping an eye on him to evaluate him. When he's up for boosters, we'll recheck his leg, maybe sedate him, take some radiographs, that kind of thing. But for now, that's pretty much the only thing we have concerns about is his left hind leg.
B2540, Sahara, a 23-year-old quarter horse mare. She was painful on both of her front legs as well as her left fetlock looked malformed. Her radiograph showed severe arthritis with partial joint collapse. And there were, with that left fetlock, the coffin bone also had a lot of bony proliferation. So between both of those front legs, not looking great, that joint collapse, all those bony changes, it was last act of kindness was recommended for her.
Yeah, she was in bad shape.
Yeah.
Dawn. That's such a calm name. Dawn is B2541. She's a bit spicy. She is an 11-year-old. We have her down as a standard bred. I feel like she might be a Tennessee walking horse. We have to guess. So sometimes we're wrong on breeds. She had a neck collar on, so she could have been used as a brood mare or an embryo transfer recipient mare or something. But for an 11-year-old, I don't think she's had much handling at all. She was great, but she took a lot of calm handling to kind of get things done. She did have an elevated respiratory rate and some nasal discharge. She also had some discharge from her vulva. She's got a scar on the left side of her face. She had some increased lung sounds in the cranioventral field. So same as the last horse in the front, kind of towards the bottom. She does have a little bit of DSLD in her right hind and a club hoof, but it's pretty mild. So you guys hear us talk about DSLD. It's chronic, progressive, incurable. But at earlier stages of disease, we can manage that discomfort, and we didn't think that this mare was uncomfortable. Her resting heart rate was in the upper 40s, but she was very anxious. And so, your heart rate can go up if you're worried. She also had elevated GGT, which usually just means cholestasis in horses, but we get concerned about liver disease. And so we rechecked it today, and it was normal, which was great. So she is turned out to decompress for the rest of quarantine.
Next, we have B25-42. She's been named Ruby. She's a 2.5-year-old mare, little chestnut girl. She had a fever on intake day of 102.2. We rechecked her today. She still has a fever of 102.2. When we listened to her, she had a murmur on the right side, and usually in young horses, when you hear a murmur on the right side, you think of some kind of septal defect or patent ductus arteriosus, which is a retained young fetal structure from when they were in the uterus. So if it hasn't closed by now, then that's the reason for some concern. So we have her down for an ultrasound, a cardiac ultrasound, but she's super sweet. But we are very concerned about her. She has some blood changes. She had blood changes on the day she came in. We repeated that blood work today, and it's not trending in the right direction, but we're hoping she'll turn a corner. So you'll have to stay tuned for her. So She is on our concerned list. She's very cute and sweet, though.
B2543. We're going to say it's pronounced Nydia, like Lydia, but with an N. 3.5-year-old mare, Tennessee walking horse. Does not like her face touched. She was very reactive around her face. Did seem to have some AV block when we were checking her heart, which we have her down for a recheck on. And some increased lung sounds, had a lot of nasal discharge, and her feet were very overgrown. So overall right now she is out. We have her down to try and get some farrier care as soon as possible. Recheck her heart. We would like to recheck it when she's not sedated, because we did give her some sedation last time, just to make sure that it didn't have anything to do with the medication she was given. And then recheck her back for any pain in her back.
Millie was a super sweet 22-year-old quarter horse mare. She was bay, and she was severely neurologic. She almost fell when she got off the trailer, and she would just kind of stagger sideways. So neurologic disease is a super vague, broad category, but basically it means there's something wrong with your central nervous system. And there are very few differentials for neurologic disease that have any kind of positive outcome. But Millie also had a pretty significant heart murmur. It was systolic. I think it probably was her mitral valve. As horses get older, there are 3 heart valves on the left, and as they get kind of looser and more flappy, we have blood kind of backflow. We have a great video of Dr. Gina doing a beautiful cardiac ultrasound that shows. But what that does is it mixes blood, and it makes the heart get tired and have to overwork over time, and it affects oxygenation. Millie also had an asymmetric pelvis, and she had really severe pain on palpation of her back, and she was so stoic and sweet. But you almost couldn't touch her back without having her flinch and cringe. And I didn't write it down, but I did give her pain medication. And she was given the last act of kindness.
Next we have B25-45. It was a branded Mustang. His name is Nitro. He was 7 years old. He was black and gorgeous and very mean. Mm-hmm. He definitely kicked at everybody. You didn't even have to be touching him. You could just be walking kind of in his area and he'd kick out at you. So because of his behaviors, he also tried to pin Haley. Mm-hmm. Like he sorted other horses out to go for her, and she wasn't even doing anything with him.
She barely got out before he got her. He charged her.
Yeah, so because of his aggressive behavior that was intentional towards human harm, the last act of kindness was given to him because of his apparent hatred of people.
Mm-hmm. It takes a lot for this team to make a behavioral euthanasia decision on a horse. I mean, we believe in decompression and time and training, but there are some behaviors that if he was not afraid, this horse was very confident. There are some behaviors that are just so dangerous. I mean, he would target kick like where your head was, that we could I mean,
he would have been dangerous to turn out.
He would have been dangerous to do literally anything with. Mm-hmm. So, yeah.
Not a fan of people.
B2546, Dakota. He is a 19-year-old paint gelding. He's a very good boy, super sweet. On the skinny side, BCS 1 out of 9. We did do some dental rats because we thought maybe that was why he was so skinny, but his teeth actually looked really good. We do have him down for a dental just to double check everything, make sure he doesn't need any work, do a cardiac recheck, recheck some blood. We did run a fecal on him just to see if maybe he had a really high parasite load, but he really didn't have much in there, not enough to result in being so skinny. So right now he's just out grazing, eating, hoping we can fatten him up and that everything else looks good. We'll probably do some other radiographs on him, just make sure that everything is sound and that he's going to be good to go. But right now he's real sweet.
Our next horse, B2547, our supporters named Dodger, which is super cute. He was an 18-year-old thoroughbred gelding. He did have a lip tattoo, so we were able to track him. His registered name was Sriracha. He also was very emaciated. His body condition score was also 1 out of 9. And this poor horse just felt absolutely horrible. His left and right hind legs were both very, very swollen, and his right hind toe just dragged on the ground when he tried to walk. I know he had really severe arthritis, and I can't accurately characterize it for you because we looked at 29 horses that day. He had a lot of significant changes on his blood work as well. He had lymphopenia, so lymphocytes are really important immune cells, and his were very low. He had low platelet count, and then he had some elevations that are concerning. His potassium was high, his blood urea nitrogen was high. That's one of the important markers of kidney health. And then his ratio of blood urea nitrogen to creatinine was also elevated. So that was another confirmation that he had renal disease. And poor buddy, he was in really terrible shape and also at risk of refeeding syndrome. And he was given the last act of kindness.
B25-48 was Valentina. She was a 7-year-old standardbred mare. She was a pretty decent body condition, 4 out of 9 chestnut. She was friendly. She was lame at the trot on the right front especially. She had severe right carpal effusion. She was not good for post. So we took some radiographs for carpus, and she had some bony proliferation. She had some distal radius changes, and she had a potential gas opacity. So she had a lot of sedation. She had dorm, maybe butorphanol for pain, and some more dorm. She was just really, really super painful. And then she tried to bite and kick Dr. Lydia several times. So because of the way she behaved, her carpal rads, all of those things together, she was given last act of kindness.
Yeah, she was really painful.
Yeah, she was not having it. Can't blame her, I guess.
All right, and then our last horse, B2549, named Thunder, was a 5-year-old Mustang, a gelding. Sound at a walk and a trot. Overall, he also looked really good. We didn't really have any concerns with him. We do have him down for a dental, just check his teeth, but otherwise he's just out, and we'll see how he's doing after 30 days. And as long as everything still looks good, he'll go into his training evaluation. And that was
Rough
it.
group.
That was all of them.
Yeah, but the ones that needed us really needed us.
Yeah.
So, and that's what we say at the end of every video. It's like, it seems super depressing to go through 28 horses and only have 10 left, but the horses that really needed us.
Yeah.
And it's a gift to be able to end their suffering on a good day, and with some good pain medication on board.